If we've never met before, I'm Dr. Trinh. I wear a whole bunch of hats, but one of my first love is really just health education, to go out and speak to folks about many health topics on preventive health and wellness. After taking care of patients for close to 20 years, I've always realized that, the 15 minutes that you get with your doctor, we never have enough time to have a chance to really chat about prevention, right? And if you're looking at 15 minutes, I think the national average is that most patients see their primary care face-to-face for about 7 minutes. And and in that 7 minutes, we're refilling your medication, writing your prescriptions, going over lab results and referrals. And by the time we're ready to talk about brain health, the next patient's here. And we never have a chance to discuss issues that are important for prevention and things of that sort. Let me ask you guys a question. How many of us here, and type yes or no, how many of us here know someone who have had Alzheimer's or memory problems? Type in yes or no if you know someone who's had memory issues with that. Wow, look at that, right? It's I don't know if you guys realize Alzheimer's is the in Orange County, Alzheimer's is the number 3 cause of death in Orange County. And so it is a epidemic in itself. The number 1 cause of death in Orange County is heart attacks, heart disease. The number 2 cause of death is cancer. And the number 3 cause of death that we've seen is Alzheimer's disease, unfortunately. The one thing that Krista says, is that true for LA County as well? I believe it is, Krista. I believe it is. It's among, I think in the United States, among seniors, among those who are above the age of 65, Alzheimer's is the number 3 cause of death. Ying Ying says, why too much refined carbs cause Alzheimer's? Okay, why is it okay, good. Why is it too much refined carbs contribute to Alzheimer's? We can certainly go over that, guys. What I'm going to do is ask you this. Let me ask you this. What causes Alzheimer's? Does anyone know? Type in what you think. What causes Alzheimer's? Anyone know behind the cause of Alzheimer's? Any thoughts on that? Type in the chat box what you think contributes to Alzheimer's. Catherine says unclear. Dennis says plaque. Adele says aluminum, brain plaque. Pamela unknown. Nancy says plaque causes death. David says I don't know. Yeah, there's Union says inflammation. Ancient brain. Diana, ancient brain. Do we all have ancient brains? There are many theories behind the causes of Alzheimer's. Rob says nutritional deficiency. The one thing that I can tie together, guys, one thing that I can tie together as a common denominator behind Alzheimer's is the presence of a plaque in your brain. The presence of a plaque in your brain. And we have a name for that plaque. We call it the amyloid plaque, amyloid beta. So I will type it down for you guys. Beta amyloid is the name of the plaque. Let's see here. There you go. Do you guys see that? Beta amyloid plaque. is what it is that it's an abnormal protein that builds up in the brain of those who have Alzheimer's. Every patient with Alzheimer's have this plaque in their brain, 100%. If you have Alzheimer's, you have the plaque. It's 100%. If you do not have the plaque, then you do not have Alzheimer's. That's 100% too. Does that make sense to you guys so far? Type in yes if that makes sense. If you have Alzheimer's, you have the plaque. If you do not have the plaque, you do not have Alzheimer's. Type in yes if that makes sense to you. It is this plaque that builds up in our brain. And ooh, Jenna says, how do you test for it? How do you test for it? So Adele has a good question. Can you have the plaque and not have Alzheimer's? That is a great question. And let me explain to you. The answer is yes. And let me explain to you why. But the first thing I should explain to you is this. In a healthy brain, we each have 100 billion brain cells. Okay, in a healthy brain, 100 billion brain cells. That's a lot of brain cells, right? And in a healthy brain, one brain cell is talking to the next brain cell. And so they're communicating with one another. The brain cells are talking all the time. So brain cell A talks to brain cell B, brain cell B talks to brain cell C, brain cell C talks to brain cell D. So they're always chatting and communicating. Every time you have a thought, your brain cells are talking and communicating. Every time you have a feeling, your brain cells are talking to one another. Every thought, every feeling, right, is a pattern of communication of brain cells. Every memory that you have is a pattern of brain cells communicating with one another. So for example, my memory of dinner last night could be this pattern of brain cells over here talking. My memory of breakfast this morning could be this pattern over here of brain cells talking, right? And my memory of chatting with you guys now, right, could be this pattern over here of brain cells, talking and communicating with one another. So every time you think, every time you feel, every memory you have is basically brain cells just communicating and talking. Now, the plaque, the Alzheimer's plaque, right? Database recall. Yes, Rob. So what the plaque does is that this amyloid plaque, it gets in the way between two brain cells trying to communicate. So it blocks the communication. It interrupts the communications between brain cells so that the brain cells can't talk to one another. So the plaque gets in the way. Does that make sense to you guys so far? That the plaque gets in the way and the brain cells can't talk and it interrupts that communication? Type in yes if that makes sense for you guys. I want to make sure that you're on the same page and I haven't lost anyone, right? With that. Type in yes if that makes sense to you guys. Good. So the brain cells are talking to one another and the plaque gets in the way and blocks the communication. And in the beginning, where there's only a little bit of plaque, right? When the plaque is only a little bit, not a lot, our brain cells can go around it. It's no big deal. And so our symptoms are really mild when there's only a little bit of plaque, right? And so maybe forgetting a word or a name, right? Or walking into a room and not remembering why you're there, things of that sort, little things, right? Only a little bit of plaque and no big deal. But what happens is the plaque builds up over time. Okay, it just continues to accumulate over time so that when there's more and more plaque that appears, the brain cells can't get around all this and the symptoms become more severe, right? To a point where you turn on the stove and you forget to turn off the stove, or you put the keys in the refrigerator rather than where it should be, right? And things starts to get kind of confusing as more plaque burden builds up. Let me ask you guys this. Let me ask you guys this. By the time a patient with Alzheimer's have their very first symptom of memory loss from Alzheimer's, right? Very first symptom of memory loss from Alzheimer's. How long has the plaque been there? Does anyone know? Any guesses? How many years have the plaque been there by the time somebody loses, start to have memory loss from Alzheimer's? Any thoughts on that? Any guesses on that? How many years? Okay, I see 50 years. Wow, 1 year. Ooh, big difference. 25 to 30, could be up to 10. Okay. So all right, lots of good guesses. I'm seeing from 1 year to 50 years. So it's got to be somewhere in the middle, I'm sure, right? So by the time a patient has their very first memory loss from Alzheimer's, the plaque has already been there for about 15 to 20 years is the answer. The plaque has built up for about 15 to 20 years. It builds up silently, no symptoms, you don't know it's even there. By the time you have memory loss, it's been there for 15 to 20 years. A little bit scary, isn't it? That this thing just kind of builds up quietly without us knowing about it. And yeah, so Alzheimer's starts 15 to 20 years before memory loss even starts, right? Alzheimer's starts. Is it dissolvable? Rob says, is it dissolvable? Yes, it is. I'm going to tell you how. Okay. How many of you guys want to learn if it's dissolvable? There's actually a process of plaque production and a process of plaque removal that occurs, right? There's a process of plaque production and a process of plaque removal that is occurring all the time. And Alzheimer's occur when plaque production exceeds plaque removal, right? Alzheimer's occur when you make more plaque than you can remove. So the plaque just builds up and, and it's associated with Alzheimer's. So the next question we have is, what causes the plaque? But the question before what causes the plaque is this. Even before we answer what causes the plaque, let's ask, how do you know if the plaque's there? Is there a test for it? Is there a test for it? How do you know if the plaque's even there? Does anyone know how to detect this plaque? Anyone know how to detect this plaque? Any thoughts on that, guys? Any thoughts on how to find the plaque? I see MRI, I see PET scan, I see MRI. Any other thoughts on how to detect this plaque, this Alzheimer's plaque? Okay. So if you were to ask me this question, I don't know, 10 years ago, right? How do you detect, how do you confirm the Alzheimer's plaque? 10 years ago, I would have told you autopsy would be the way to find the plaque, right? And so it just wasn't a really good prevention program back then, because we had to wait till you're gone, right? At that time. Ooh, Vienna says, is there a new test with blood work? So 10 years ago, the only way to confirm it was an autopsy. In the last number of years, we have FDA approved brain scans called PET scans. PET scans. Have you guys heard of PET scans before? Type in yes if you heard of a PET scan before. Yeah? No? Yes? Most of you guys have, huh? Yeah, PET scans are normally done for like cancer evaluation, cancer staging, things of that sort. But we now have, Vienna says you did that with me. Yes, Vienna has been through our program. People are like wondering what you're talking about, Vienna. So we have these brain scans that we actually offer these PET scans. You can't get these specialized PET scans with your doctor. It's a very specialized PET scan where we inject a little medication. The medication goes up to the brain and it looks for the plaque. And if you have the plaque, the medication will tag it and light it up on the scan. And so we can see this plaque on a scan. Not only can we see the plaque on the scan, we can see the plaque many years before your symptoms even start. We can see the plaque many years before the symptoms even start. Alice has a good question. Drugs that prevent plaque fail to stop them. There isn't any drug to prevent plaque, Alice, at this point, but I can tell you what's in clinical trials with that. So yes, the technology is there. The PET scans are there. The bad news is that it's not covered by insurance. The good news is that if you're part of a clinical trial for Alzheimer's, which is kind of what we do in Irvine. I'm inside the Alzheimer's Orange County building in Irvine, where my office is at, and we do clinical trials in there for Alzheimer's prevention, Alzheimer's reduction, things of that sort. And if you're part of a clinical trial, then it's no cost to get these brain scans, these PET scans with that. And so in the setting of clinical trials, you could find out if you have plaques or not. It's really the only setting that you can get these brain scans, actually. The good news is that clinical trials are free. There's no cost to it. If you guys are ever interested in knowing if there's plaque in here, if you're part of our clinical trial and you're a candidate, then we'll scan your brain and then we'll let you know if there's plaque or not. The question is, what do you do with the results? What if you do have plaque, right? What can you do about it is the big question with that. The other thing is, I saw a comment about blood tests. Can you detect plaque on a blood test? By the way, how many of you guys really want to know if there's plaque or not? Type in yes if you want to know. Type in no if you rather not know. Serious? Dang, why would you want to know? Aren't you guys scared? Isn't it scary to know? Or no, not really. Why? Type in why would you want to know? I'm curious, why would you want to know if there's plaque or not? I mean, why, doesn't it make you depressed? Pamela says not unless there's something one can do. George says planning. What kind of planning? How do you guys prepare? What kind of planning would you do? How to deal with it, right? Change my attitude. Take precautions for the future. Okay. Preliminary future for cardiac issues. Very interesting. I guess you could plan. I guess if I knew there was plaque in there, if I knew there was plaque in here, one thing we could do is maybe I can change my diet. Maybe I can change my lifestyle, right? Maybe I can change my lifestyle. Maybe I can change my diet. Maybe there are things I can do to help minimize the risk, right, for plaques getting worse or things of that sort. If I knew, maybe I'll take a vacation, right? Maybe I'll go around the world while I still have my brain. Or I don't know, for some of us, maybe we'll take out our will and look at those names and decide whose name we want to cross out now, right? Or add in. Maybe we'll edit our wills. But anyway, before I diverse, so yes, you can see it on a PET scan. By the way, if you guys are interested in knowing if you're a candidate to get a brain scan, if you're a candidate, it's all in the context of a clinical trial. You have to be a candidate for the clinical trial. And if you are a candidate for the clinical trial, then you get your brain scans. We do have clinical trials where if you're a candidate, you get a blood test to look for the plaque. You actually get a blood test to look for the plaque without the need for a brain scan. So we have, and that's all for no cost. Obviously, we don't charge for that as part of clinical trials. How many guys would be interested in a blood test to look to see if the plaque's there? Anyone interested in that? And really, okay. Oh my word. Why not, huh? All right. Okay, I'll tell you what you can do. The blood test is not available to the public. The blood test is available through clinical trials. So I've sent a lot of people to my office to get that blood test. They have to be part of, they have to be a candidate for the clinical trial. If they're a candidate for the clinical trial, you get the blood test to see if the plaque's there. The specific study we're doing for that is called the Alzheimer's prevention study. Anyone here interested in Alzheimer's prevention? Right, that's the specific study that we do. And in that study, we offer folks, a blood test to see if we offer people a blood test to see if the plaque's there. Yes, it is the tau tangles, Pamela. Yes, plaques and tangles. It is the tau protein. It's not through the spine. There's no spinal tap. It's just a simple blood test to look for, in this case, tau tangles, which is part of the Alzheimer's protein that we see. So there's blood work and there's brain scans. What I want to talk about now is what you guys want to hear about. What causes plaque production, right? What causes plaque production? So let's chat about that. By the way, if you have a pen and paper, I'll give you our office number. And you can just give our office a call and say, Dr. Trinh spoke to me. I'm interested in, the Alzheimer's prevention study. And if you're interested in that, if you're a candidate, we draw your blood and we'll tell you if the plaque's there or not with that. Okay. Do you guys have a pen and paper? Type in yes if you have a pen and paper and you're all set. And I'll give you my office number here. And you can just take it down. And then we'll go ahead and talk now about plaque production. Okay. So here is my, hold on, let me put in my, there you go. Take down the office number there in the chat and you can just write that down and just give a call, whenever, today, tomorrow, and just say you're interested in a blood test, Alzheimer's, clinical trial, Alzheimer's prevention studies, what you want to call for the blood test. There are over 30 different factors that lead to plaque production, over 30 different factors that lead to plaque production. And rather than telling you all 30 different factors that lead to plaque production, because you're going to run out of writing space, and because I probably won't remember all 30 myself because my memory's poor, I'm going to categorize it for you guys into 3 different categories. Okay, I'm going to categorize it for you guys into 3 different categories that lead to plaque production. Okay, 3 categories. Category number one is the circulation category. The circulation category. Anything that causes poor circulation to your body will also cause poor circulation to your brain and lead and give you a higher risk for Alzheimer's. Okay, circulation problems. Why do I say that? I say that because if I took 10 patients with Alzheimer's, right? If I took 10 patients with Alzheimer's, 8 out of 10 will have high blood pressure. And high blood pressure is a circulation problem, right? It clogs up the circulation with that. George says, how long is your study scheduled to run? It depends, George, because if we do your brain scan or if we do your blood test and you don't have the plaque, then you're done with the study. We congratulate you and you're done. So the study's really short, right? Once you get in our study and we scan your brain or we test your blood, if there's no plaque, then you don't need the study. You're done with the study. So it can be super short like that. If we scan your brain or if we draw your blood and we see plaque, then we have medications in clinical trials that are designed to remove the plaque. Our goal is plaque removal. Okay, that is our goal. And we hope that if we can remove the plaque early while your symptoms are super mild, while you can still have a conversation with me, or while you have no symptoms, right? Even if you have no symptoms, but there's plaque, we want to remove the plaque before the damage occurs. Does that make sense to you guys? We want to remove plaque before damage occurs. Does that make sense? Type in yes if that makes sense to you guys, right? So our goal is plaque removal before there's significant damage, because that's where prevention comes in, right? Prevention is you want to find it before there's damage, okay? And that is what we want to do. It's in these clinical trials that we do, is we want to do it early before there's problems. And to get more information, just call my office. We'll give you guys a lot more information on that. Okay. Annette says, is there natural ways to remove plaque? Yeah, we're going to talk about that. So circulation is the first bucket out of 3 buckets. Okay. If I took 10 patients with Alzheimer's, 8 of them have high blood pressure, 4 of them have diabetes. 4 out of 10 patients with Alzheimer's have diabetes. Did you know that if you're diabetic, your risks for Alzheimer's double compared to those without diabetes, right? If you're a diabetic, your risk for Alzheimer's is double compared to someone without diabetes. And the scary thing about that statistic is that in the United States, 2 out of 3 of us have either diabetes or pre-diabetes. In the United States, 2 out of 3 Americans have either diabetes or pre-diabetes. How do we detect that? We detect it on a blood test called the hemoglobin A1C. Anyone heard of the hemoglobin A1C? Do you guys know what that is? Type in yes if you heard of it, or no. Yeah, that's right. Good. Most of you guys are familiar with it. And I'll type down what it is here. Hemoglobin A1C blood test. That's the blood test there in the chat. I just put in, that's the blood test that we look for diabetes. The hemoglobin A1C above 5.7. Ooh, does it include children? I think that's a good question. I don't know if they did it only on adults, but I think in general, it includes everyone in the United States. 2 out of 3 of us have a hemoglobin A1C that is in the pre-diabetic range or the diabetic range, right? So hemoglobin A1C above 5.7 is pre-diabetes. A hemoglobin A1C above 6.5 is diabetes. Okay, so above 6.5, you're diabetic. Between 5.7 to 6.5, you're pre-diabetic. Below 5.7, you're normal. Okay, non-diabetic is what we use. So 4 out of 10 patients with Alzheimer's have diabetes, high risk, right? Sugar is a toxin. 3 out of 10 patients with Alzheimer's have heart disease, And many patients with Alzheimer's have high cholesterol. Why is that? Because cholesterol clogs our arteries, right? Cholesterol clogs the artery, messes up the circulation. When it messes up the circulation, it increases your risk for Alzheimer's. So that is the circulation bucket of Alzheimer's disease, of plaque production. That's bucket number one. Bucket number two is the inflammation bucket. The inflammation bucket. What does that mean? Inflammation is good or bad? What do you guys think? Is inflammation good or bad? What do you guys think? I see bad. Muriel, Barbara says bad. Joanne says bad, 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 bad. Okay, all right. Acute inflammation is good, according to Ying Ying. What about good versus bad cholesterol? Good cholesterol is good, no worries. It's the bad cholesterol that clogs up your arteries. Yes, so Pamela says bad unless you're fighting a disease. Yes, so let's say you have a fever. Let's say you had the flu and you had a fever because of the flu. It simply means your immune system, right? Inflammation basically means your immune system is trying to fight something, like the flu virus, right? If you have pneumonia, you have an infection, the inflammation is basically your immune system fighting the bacteria, fighting the virus, right? It creates inflammation in this process of attacking what shouldn't be there. Your immune system also attacks toxins. It attacks just bad stuff in general, poisons, anything that should not be in your body is attacked by the immune system. And in the process of that attack is when we create inflammation. Okay, not necessarily a bad thing, not necessarily a bad thing. What's bad is this. What's bad is if the inflammation is chronic and long-term. So if I had a fever from the flu, no big deal, it's fighting the virus, right? The flu virus. But if I had this fever every day of the month, then that's not good. Because it's like going to battle, going to war, and you're trying to shoot the bad guys and you're accidentally shooting the good guys, right? You're shooting your own body. So what's bad is chronic inflammation. Chronic inflammation is what's bad. Pamela says the psoriasis correlate with Alzheimer's. I don't think we've looked at that, Pamela, regarding psoriasis, but I do know that chronic inflammation is associated with Alzheimer's. Okay. How do we know that? We know that because whenever we do autopsies of the brains of patients with Alzheimer's, not only do we find the plaque, right? The Alzheimer's plaque and the tau tangles, we also find a lot of inflammation cells in the brain. So we know that we have a brain that's very inflamed in Alzheimer's. So inflammation is bucket number 2 out of 3 buckets that lead to plaque production and leads to Alzheimer's. Okay. Okay, bucket number 3. Bucket number 3, as far as factors that lead to plaque production, bucket number 3 is toxins. Toxins. Okay. Give me some examples of toxins, guys. Give me some examples of toxins. Anyone know any examples of toxins? Any thoughts? Any guesses? Alcohol, yes. Excessive alcohol. Food, oh no. Sugar. Vapors from chemical. Carbon dioxide. Infections. Yes, yes, yes. Yes, those are all examples of toxins. Absolutely. Did you know that if you live in an area of high pollution, you have a higher risk of Alzheimer's compared to somebody who live in an area of low pollution? Right? If you live in an area of high pollution, you have a high risk of Alzheimer's compared to living in an area of low pollution. Pretty crazy, right? Because pollution is a toxin. It just comes from the air, right? As opposed to food. Yes, lead, mercury. Yes, yes, yes. Jenna says Glenna says, don't say chocolate. So I'm not going to say chocolate. Um, so, so let me ask you this. How many of you guys are like me where you enjoy a medium rare steak? A medium rare steak. Tobacco smoking is toxin, yes. David likes a steak. Barbara likes a medium rare steak. That's it? There's only 2 of us who like steak in this group? Oh, okay, all right. All right, that's rarely rare. Vegan, oh no, I'm sorry. I'm just kidding, Adele. A plant-based diet is awesome. What that George, like, well done. So let me ask you this: when you're eating a medium rare steak, are you just eating a medium rare steak? Don says vegetarian and a chocoholic. I've never seen a vegetarian and a chocoholic go in one word, one sentence. That's amazing. You can be I guess you could be a chocoholic vegetarian. I like that. I like that. That works. That works for me, right? And so, so when you're eating a medium rare steak, you're not just eating a medium rare steak, and I'll tell you why. You're eating what we put into the cow. You're eating what we pump into the cows. You're eating what the cow ate. What do we pump into our cows these days, guys? What do we pump into our cows these days? What do you guys think? Antibiotics, hormones. Why would we give our cows antibiotics? Well, we do that because we don't want a cow to get sick and die, right? That's right, Yin Yang, so they don't get sick and die. Because if they get sick and they die, there's no profit, right? The cow owner loses out on their profits. And oh, George says, remember the chickens. When do we start pumping antibiotics into chickens? That just makes me really sad. 5 years ago, there was never a label on a chicken. You know, when you go buy chicken at the grocery store, I never remember seeing labels if there's antibiotics or no antibiotics on these chickens. And now there's labels all over the place. It's just very sad, guys, what we are doing to our cows and our chicken and all that. But back to the cow, right? We pump antibiotics in so that they don't get sick and die. We pump in hormones so that our cows can get fat, and so that they can grow really fast because they're sold by the pound, right? Just like when you buy beef, right, by the pound. And so more profit basically is why we pump antibiotics into our cows, why we pump hormones into our cows. And guess what does the cow eat, right? What does the cow even eat? If the cow is eating grass, how do you know that the grass was not sprayed with pesticide? If the cow's eating corn, how do you know this stuff was not sprayed, right, with pesticide? And so, yeah. So do you guys see now what I mean when I say toxins in our food? Does that make sense? Even in a medium rare steak, right? Even in a medium rare steak, when I talk about toxins, I'm talking about all that junk that is pumped into our cows, into our chickens. Because when your immune system, which is in the bloodstream, right? When you're digesting your steak, you're digesting your beef, your hamburger, your hot dog, you're digesting your steak, and into the bloodstream is floating around antibiotics, hormones, pesticides. What does the immune system do when it sees all these things floating around in your bloodstream? How does the immune system respond when it sees these chemicals floating around in the bloodstream, guys? What about pork, huh? I don't know. What do we do to our pork? Do we give it hormones and antibiotics? Anyone know? Right? And so George says traumatize cows. Yes. So when our immune system sees the antibiotics from the steak, or the hormones released from the steak, or the pesticides and herbicides released from the steak, our immune system is threatened and attacks it. And so in the process of our immune system attacking the food and the stuff that comes out of the food, what is created in the attack when the immune system sees the antibiotics and sees the hormones? What is created when the immune system is attacking these things? What is the byproduct of that? Inflammation is created. Inflammation is the byproduct of the immune system's attack, right? And you know what? If it was a one-time thing, if it was just a one-time thing where you ate your steak, the immune system attacks the antibiotics and the hormones and all that in the meat you ate, and you get a flare-up of the immune system, and you get a flare-up of the inflammation, and the inflammation goes down and goes away, no big deal, one-time thing, right? But my question is, how often are we eating these types of food on a regular basis? It is part of the American diet, right? Meat is part of the American diet. Sugar, which is very toxic, is part of the American diet. And so the American diet, because of what we eat and the junk that gets into our bloodstream, the immune system is attacking this every meal, every day. And every meal, every day, there is a battle that is going on in your body where inflammation is being created, right? Every day, there's a battle between all the junk that you give, that we feed ourselves, and the immune system attacking it, that inflammation is being created. And so what happens now is that we create chronic inflammation. And I've tied in for you chronic inflammation with Alzheimer's, right? So what I'm really saying, guys, is this. We are eating ourselves to Alzheimer's, right? We are eating ourselves to our diagnosis. We are eating ourselves to poor brain health. Does that make sense to you guys? Type in yes if that makes sense. That we're eating ourselves to our diagnosis. Absolutely. Absolutely. We're creating our own diagnosis. The number 3 cause of death is because we eat ourselves to our diagnosis, right? To Alzheimer's and to poor brain health. So those are kind of the 3 categories that lead to plaque production. So that's bad news, but it's also good news, because now you know what you can do to minimize your risk for Alzheimer's, right? Now you know what you can do to minimize your risk for Alzheimer's with that. So what I'm going to do now is I'm going to give you 12 things that we can do to minimize our risk for Alzheimer's. Pamela says, what about ApoE4 and genetic markers? Yes, ApoE4, if you guys don't know, is a gene. It is for Alzheimer's. It is an Alzheimer's gene. And in the United States, 1 out of 4 Americans have this gene. 1 out of 4 Americans have the ApoE4 gene. So kind of scary, isn't it? Now, let me tell you something about the gene real quick. If you have the gene, it does not condemn you to the diagnosis. If you have the gene, it doesn't guarantee that you're going to get Alzheimer's. Why is that? Because lifestyle plays a bigger role than genetics. Okay, lifestyle plays a bigger role than genetics. If you do not have the gene, if you do not have the Alzheimer's gene, it does not guarantee that you won't get Alzheimer's either. Why is that? Because lifestyle plays a role. Make sense, guys? Lifestyle plays a bigger role than genetics. The gene is there, but the lifestyle trumps that. okay, whether you get Alzheimer's or not get Alzheimer's. Does anyone know where they can get their genes tested, the ApoE4 gene? Does anyone know how to get that tested? Anyone know? I'll tell you how. Yes, yes, yes. Pamela says 23andMe. That's how you get it tested. You guys have heard of 23andMe, right? I think they're like part of ancestry.com or something like that. But 23andMe, if you get that test, I don't know the cost anymore. Last time I checked, I think it's like $100, and they'll tell you what genetics risk factors you have. But the Alzheimer's gene is part of that test if you're interested to find out. Okay. Now, so we talked about the brain, we talked about the plaque, we talked about how to detect the plaque, right? Brain scan or blood tests you can get at no cost at my office if you're part of a clinical trial. We talked about what causes plaque production, right? The three categories: poor circulation, inflammation, and toxins. So in the next 7 minutes, I'm going to give you 12 things you can do to reduce your risk for Alzheimer's. Does that sound good to you guys? We're going to crank this out. 12 things you can do to reduce your risk for Alzheimer's. All right. What I'll do, I'm going to give you guys my email here. Feel free to email me because, it's hard to give you the cure for Alzheimer's in an hour, right? And you'll have like other questions later on. But let me give you my email. Just take down my email here. You can always email me with questions like that. I also have an ebook I can send you on Alzheimer's risk reduction that's available. Email me. I'll send you my ebook. You don't have to buy it on Amazon or anything of that sort. And we'll get it over to you. Okay. Now, 12 things. Number one, high blood pressure is a modifiable risk factor. If you have high blood pressure, it increases your risk for Alzheimer's, which means if you keep your blood pressure under control in a normal range, even if you need meds to do that, it lowers your risk for blood pressure. That's number one. Everyone get that? High blood pressure. Number two, smoking. Smoking is a risk factor for Alzheimer's because smoking belongs in the toxins category, right? Smoking belongs in the toxins category. High blood pressure belongs in the circulation category. Smoking is completely modifiable because we decide if we smoke or not. Okay, that's number two. Number three, diabetes. Diabetes is something we can control because we get to choose what we eat. We get to choose how much exercise we do, right? Diabetes is lifestyle. So by choosing the right foods, you can improve your blood sugar, right? One of these days, I'll give you a whole lecture on sugar, right? It'll take me an hour to do it, but I'll explain the entire science behind that and how it's not that great for you, right? So number three is diabetes. So lower your sugar, you will lower your risk for Alzheimer's. Number four is obesity. Being overweight is actually a risk factor for Alzheimer's. And I'll tell you why. It's not because you're overweight that you just get Alzheimer's. It's because what causes the obesity is actually the excess sugar that we eat that we cannot burn through our lifestyle and our physical activity. So sugar is energy. When you eat foods that are, sugary, or when you eat, refined carbohydrates, white rice, white bread, pasta, right? Spaghetti, pizza, all that stuff, that the carbs that break down to sugar, if that sugar is not used for energy, it gets stored as fat. So the sugar causes the obesity. So it's really the sugar that drives the inflammation that leads to the Alzheimer's. Okay, the obesity is the byproduct of that. So if you live a lifestyle that can control obesity, then I know you're living a good lifestyle that actually, minimizes sugar and everything else. Okay, so by losing weight through a good lifestyle, you lower your risk for Alzheimer's. Next one, lack of physical activity is a risk factor for Alzheimer's. So you want to increase physical activity. We recommend at least half an hour a day of some fast walking, or you don't have to run or bike. You just got to do stuff that increases your heart rate a little bit. Okay, do activities that increases your heart rate, and when you do that, it improves the circulation up to your brain, and by improving circulation up to your brain, you lower your risk for Alzheimer's. Judy says, please resend email. Judy, my email is right there, dung.trinh@alzoc.org. Right above your comment is my email. I'll put it down again, alzoc.org. There you go. You guys see it? Okay. Lack of physical activity is a risk factor. Next one is poor diet, poor nutrition. What is the appropriate nutrition? Let me send you that, since we only have like 2-3 minutes left. I will email you the nutritional guide that will cut down your risk of Alzheimer's. Shoot me an email. It is a plant-based nutrition. It is a specific diet. It is actually inside my ebook, which I'll email to you. Just shoot me an email on that. But nutrition plays a huge deal, because nutrition can either increase inflammation or lower inflammation. Okay. Next, alcohol consumption. Too much alcohol messes up your brain, increases the risk of Alzheimer's with that. Too much alcohol will mess up your brain and increase the risk. Next, low levels of cognitive engagement. What that means is not using your brain, right? You want to do activities to stimulate your brain. We call that brain exercise. Okay, and this is activities such as, for some of you guys, it may be crossword puzzles. For others, it may be Sudoku, playing chess, playing checkers. For some, it may be taking a class, learning a new language, right? So doing all these activities to stimulate your brain will lower your risk for Alzheimer's. Next, treating depression. Depression actually increases the risk of Alzheimer's. If you have issues with depression, that needs to be taken care of, okay? Next, traumatic brain injury. We see a higher risk of poor brain health and Alzheimer's in boxers who get their head boxed all the time, football players, right? Those who get a lot of traumatic brain injury will increase the risk of Alzheimer's. That's something that's preventable, right? Next, hearing loss. This is huge. Hearing loss is a risk factor for Alzheimer's. Why is that? Because when you can't hear well, you're losing an entire input into your brain. You're losing an entire portal of stimulation to your brain, and we want your brains to be stimulated. So this is something easily treatable, guys, and I'm talking mainly to the guys, because it's always the wives that bring in their guys and say that he's not listening to me. And so, I mean, is it selective hearing loss or is it real hearing loss? I'm not sure, but if you do have hearing loss, right, that's treatable with a hearing aid. Okay, that's treatable with a hearing aid. It's hearing loss. Next, so that's number 10. That's number 10 is hearing loss. Next is social isolation. Social isolation. We know that people who are socializers, they go out and they spend time with family and friends, and they interact with others. They have a lower risk of Alzheimer's than those who don't socialize. Okay, meaning those who stay home all day alone. And it probably has something to do with that brain stimulation when you're socializing, which is super important, right? Stimulating your brain. And lastly, number 12, air pollution. Air pollution. So I don't know, that's not an easy one, because I'm not asking anyone to move to, areas of low pollution but high pollution. But air pollution is toxin, right? It's kind of like smoking is toxin. You're getting toxin into your lungs, which gets into your body, and your immune system attacks the toxin, creates the inflammation, and as a result of that, causes higher risks of Alzheimer's. Those guys are the 12 things that that you can do to to lower your risk for Alzheimer's. With that, sorry, I went a little bit overboard. It's 3:02.
That was wonderful. Thank you, Dr. Trinh. I'm certain that we all, I appreciate the way you explain things. It makes it easy for us to understand. So that was fantastic. And for all of you wondering, this was recorded, so we will have this on our website. We will also send you, as we reach out to you to thank you for joining, we will attach Dr. Trin's email so that you can reach out to him.
Okay.
And appreciate you all being here. Have a great rest of your afternoon. And there's just one last quick question about sleep apnea. Do you want to address that before we
Yes.
sign off?
Yes, sleep apnea is part of the circulation problem. When you have sleep apnea, you're not breathing, and so your oxygen level goes down, right? When your oxygen level goes down, that obviously affects your circulation. So sleep apnea is part of the circulation bucket, right? Sleep apnea is part of the circulation bucket. I'll put my phone number there again for you guys, 949-753-1663. You can just call our office if you're interested in, a clinical trial for a brain scan or a blood test for Alzheimer's and all that stuff. Everything we do is no cost, by the way, with that. All right.
And then we'll get that ebook out to you. Just email Dr. Trin. And again, I'll get that email to everybody as well. So we'll get that to you. And thank you all for joining. It was fantastic. Thank you, Dr. Trin. Really appreciate it. And we have to see you soon. Okay.
Bye.
Bye.